Welcome back to Holistic Healing Association. Trauma can impact us in many different aspects in our life. It can have a profound impact on the family unit. Often people think of trauma as PTSD, domestic abuse, sexual assault, being bullied. Trauma can affect everyone. It is not always what happened to us, but what we did not receive. Trauma can look like a person going into rage, people in shutdown, people constantly staying busy, constant fatigue, disassociation, emotional numbness, shame, anxiety, deep grief, social withdrawal, having a hard time trusting people. Today I have with me Dr. Kimberly Duncan. Thank you, Dr. Kimberly, for joining us. Can you please tell us a little bit about yourself?
Yes. Well, thank you so much for having me. And I am my doctorate's in psychology, so I'm a PsyD, and I'm an LPC, which in the States is a licensed professional counselor. And then I'm a somatic experiencing practitioner. And I run a group practice called 14 Peaks Neurophysiological Trauma Treatment. And so all our clinicians, this was a vision I had, all our clinicians are trained in somatic therapy, and we specialize in trauma.
Awesome. And what is trauma?
Yeah, so I love what you were saying. So I'm going to add a little bit of some of the things we do, but that was awesome. Uh, Trauma is when our nervous system gets stuck. And so if the nervous system gets stuck in fight, flight, freeze, or peace, then we consider that trauma. And a few other areas other than that you mentioned that we particularly do that are a little more specialized is we do traumatic brain injuries, whether that's athletes or Marines who have shot over and over and over and they get that concussion on them. We do trauma is also medical trauma. So it may not necessarily be you have parents or your childhood wasn't good, but you're born with a cord wrapped around your neck, or you have scarlet fever as a baby. So those also are events that can get your nervous system stuck. And we call those near-death experiences, which we also do. That would be trauma. But if I was just to define it, I would say it is, it's not an event, it's where the nervous system gets stuck.
And trauma can impact generations of generations, can it not?
Absolutely, yes. We do a program called, I wrote a curriculum called Your Story, and that's one of the things we do is we spend a whole session on intergenerational trauma and how we can have a propensity towards that if the environment is right. And so we do a lot of work here trying to change the next generation.
And what percentage of people have trauma?
So don't have a percentage as to who's had trauma, but I think we've probably all experienced events that affected our nervous system. And it depends on how we reacted in that event if our nervous system got stuck. So we probably all experienced it, and it just gets stuck in something.
Okay, thank you. And why do some people not realize they have trauma and others are afraid to admit that they do have trauma?
Well, that's a great question. I would say I think some people don't know that they have trauma because they've gone into what we call a functional freeze. And so I can function with it, and I have no idea that there's a different level where I can feel regulated, and it gets familiar. So, that was part of where I was stuck is in the sympathetic nervous system, the fight flight. And that was comfortable. I was an athlete. It helped me disassociate and run long distances. And so,
Same here. I'm exactly the same. Matt Kay even said that. He's my teacher, and he said, "Erin, you are stuck in it." And the same here. I'm like, I need to run. I need to go. And like,
yes.
yeah.
Yes, I was a little bit upset after I did my trauma work because I couldn't do such long distance because I couldn't disassociate. So, yes, so exactly that. Like, so, or we use like sports, like you're saying, to regulate, and we don't know why we're doing that. The body innately does that. And so we don't think we have trauma. That's going to be part of my story that you'll hear, that I would have said I had a perfect childhood. So, no, it's not the case. Um, I think too, I think we're coming out of this, but some stigma, with saying you have trauma. Um, I know we're starting to normalize it with the veterans, and I hope with our first responders will come on board with that too. Um, but I
Because
think
I personally believe we all have trauma. Same thing. I was like, what are you talking about? I'm like, I don't have trauma. And everyone's like, yes, you do. And I'm like, I don't have trauma. I'm like, I'm here to help people with trauma. And
yes,
I was like, I'm here because I care. And people were like, look again. And kept on saying, look again. And I was like, well, I'm like, I definitely don't have developmental trauma. I'm like, my childhood was like perfect. And they were like, look again. So I totally understand what you're saying. And can you tell us about your trauma story?
yes, and so this was interesting when you asked me this question, and it's because of what you just said. I got into this to help other people. And so normally people ask me, why'd you get into this? And that's an easy answer. And then when you said, could you tell your trauma story? I was like, huh, like I don't usually do that. Um, and it's good because I've got a whole curriculum written on how to tell your trauma stories. So I really appreciated the question. And I think the last time I was asked to tell my story in church, we call it a testimony. We got up in front of our small group, and we were, I was in my late 20s, just got married, and said my childhood was perfect except for one event. And, I would learn several years later that was not the case. So my parents were really young when they had me, 20 and 21. And my dad was a preacher. And so grew up with a lot of, and this is, so people may think differently. I don't think this was unnecessarily part of my trauma, but that was a very strict environment, very punitive. And my mom stayed at home. And then my grandparents on my dad's side, talking about intergenerational trauma, had a lot of mental health issues, but I wouldn't say were abusive. My dad just grew up poor. And then my mom's side, my granddad was someone that we all feared, and didn't realize it at the time. That's why I would say like it was just fun because he let us do fun things. But he did things like at 12 years old, I was stopped by a policeman for driving on the freeway because he had me drive. Yeah, it's kind of funny. I was scared by if I was going to get in trouble with my parents. I was like, he's the one that made me drive. But my sister, when she was probably 6, rode a go-kart with no shoes or sandals and messed up her foot. My cousin was 3 years old on a backhoe. If you skied with him because he owned a marina, you better not fall because he might not come back and pick you up. So he was just a man that a lot of people feared, and I didn't really know why. But prior to understanding why, most of my childhood, and I think this was part of why I thought I didn't have any trauma. I'll be curious because our stories haven't lined up so far. I love to play. I did make believe. I played cops and robbers, Johnny West and Jane. No, I'm a 7 on the Enneagram, so I like having fun. And
Yeah, no, I think our stories are lining up. I mean, my dad wasn't a minister, but it was very like, yeah, it was a very wholesome home, but it was strict. And my mom stayed at home. My dad worked. My dad's actually Catholic. My mom is Protestant. But yeah, so it is. There's definitely similarities.
no, I'm seeing this. I love this. So, so we did, with my dad being a pastor, moved every 3 years of my life. Again, I kind of thought it was exciting. It did impact my attachment style. I'll say that. Um, I get bored after about 3 years now, but I'm working on that. Um, but then at 12 years old, I went to stay with my grandparents at the marina. And, part of that was fun. I would help my grandmother cook and pump gas and everything. Um, and at this time, I had no idea that my granddad was a child molester. Nobody ever said anything. And so I was the only one out there with him. And at 12, that's when he tried to do something to me. And I would say, do what?
I said, I'm sorry.
Oh, thank you. Thank you. And I would say I went through the stages, when we're looking at in that moment of freeze, flight, freeze, and then fight. And it was a really interesting response when I think about kids who are 12 now, because I was like, you know what? That will never happen to me again. It'll never happen to anybody else on my watch. And I was little. I was always like a grade. Everybody thought I was a grade younger. And this man could have played pro football. He's just this big, huge man. But I was like, and I don't know if that was, well, I'm sure part of that was God. Part of that is my personality of, going into fight. When I was in grad school, and they said, okay, if somebody jumped out at you with a knife, what would you do? And most people went like this, and I went like this. So it's my.
We're very similar.
I love this.
Because I actually had a guy put his hands around me once, and I went right in like this and fought him off. And he was a lot larger than me.
Yeah.
So I went right into fight mode. So yes, there are definitely some similarities.
Yes. Yeah. So we were supposed to connect here. Okay. So after that, about a year and a half later, I was watching, I think it was called Family Ties, and they had, showed a similar situation. They were like, if anybody's ever done this, you should tell somebody. I went, oh, like never it entered my mind that you should tell somebody, which says a lot about our family. Like we avoided a lot of things. There was fun, but not a lot of, serious talk. And so I told my aunt, and well, no, I told my cousin who was my best friend. And when I'm doing trauma work, we're always looking for resources. And my cousin was 6 months younger and was definitely one of my resources. We were best friends.
Nice.
But so she told her mom. And then she was like, my aunt, who was another good resource, was like, this is not your fault. And I was like, well, heck yeah, I know that's not my fault. I know a lot of people, I went the opposite way, like, well, that's dumb. I know that. But then I'm pretty sure I know when she told my parents. And I think this is one of the hardest parts of my story. I would say I worked through that other part pretty easy, but no one ever spoke to me about it until I was going to get married and talk to my husband. And so just went into that mode of I'm going to protect everybody. And a couple of things that stand out is one, my sister was in middle school, and so I should say my grandparents were always in our life. They would babysit us while my parents went on a mission trip. And they were just around a lot. And so he was visiting us in California, and my mom said, will you go pick up my younger sister? And so I was like, I'll go, because with him, I couldn't drive yet. And so I would always go just to protect my sisters. Then a couple of things that stand out, was like after telling them, being left with him. And then we did a few trips from California to Texas. Like he would give us a car, but you got to go there and drive back with him. And so that was kind of the things that were happening that I didn't realize were, okay, that's not okay, and then the other piece that I realized later, because I would say, oh, there was this one incident and then it never happened again, was since I was an athlete, he was always doing things like, we're going to check on you or massage your shoulders or things like that. And there were other adults in the room. So that was very confusing. them knowing this information and this being allowed. And it wasn't till,
That would be confusing.
yeah. Yeah, it wasn't until my 40s, so I was like, oh, like that's why I felt uncomfortable. Um, so fast forwarding to before I was going to get married, my husband was working in mental health at the time. Actually went on to get his master's in counseling, but he's a cabinet maker. So we always say he got the degree to help with all our families. So it is nice having someone who knows. I didn't know anything about counseling at the time, but anyway, I talked to him and told him, and he was like, let's write a letter and tell him what he did and that we're not going to see him anymore. It's like, okay. So we did that. And, if he came over, we left. The only time we'd ever stay is if there was other children around. And so my husband was a huge part in helping me set a boundary and go, okay, this is not okay. And
He sounds like a blessing.
yes, absolutely. Yes. Yeah. And, after that, I still didn't, for 20 something years of marriage, never told anyone because I thought you were always going to have to live with it. Flashbacks, somebody touched my shoulders. I just felt disgusted. A lot of sensation issues that I would have never until I learned about trauma, why I have to have my sheets tight and no wrinkles was actually part of trauma and me just being so touch sensitive. And so we were going to do some family counseling when my son was in middle school. And so, we were going to have him go to counseling and my husband's like, no, because they can't really talk to us. We're going to go as a family. And I'd never been to therapy. So I was like, okay. So, I'm in my late 30s and the family counselor at one point went, hey, this sounds like what you were saying earlier. It was like, hey, I think you might need to see an individual therapist. Like, why? So I did. And this is partly what led me towards somatic, but mostly my son did, because he had this therapist say, while he went through DBT, and I think DBT is great for skills, but he asked a therapist, he was like, will I always be angry? And he was like, yeah, you're always gonna have to use these skills to be angry. And I'm like, I don't think so. I was like, I think we can change at the nervous system level. And that's when I started researching.
And
Yeah.
Okay. And somatics. Okay. Okay. And you had mentioned when we were talking that God played a part in this.
Yeah, absolutely. So I felt like, well, one, when I look back on my life, although our religion was very punitive, very guilt driven, but I never really felt like that with God, and I know he was with me as I went through these things. When I did EMDR on the event with my granddad, I actually pictured one of my resources was an angel being the one that helped me get up and walk to my grandmother, to safety. But yeah, absolutely. Faith is a huge part of my life. I believe I'm so thankful that God gave people the brains to study something like somatics and show me the science of how we can move through the nervous system. And God is one of the reasons I became a counselor, because so my husband is actually very kind. This is going to sound bad when I say this, but when I told him when I was going to be a therapist, he was like, you'll be a terrible therapist. And I was like, I know. Because I was a coach and a teacher, so I just like to tell people what to do.
Right.
So,
Yeah.
so I really fought that. I was like Moses going, I can't do this. And I was like, you're going to have to show me signs. And he showed me so many signs that he just shoved me through the door. God did. You're going to be a therapist. So
Nice. Okay. And you also have a black belt in karate.
I do.
Okay.
Yes. Yeah.
And how do you find martial arts helps people with trauma?
Yeah. So I love this. I wrote a protocol for developmental trauma, and I actually put martial arts as one of the treatments we use at a certain level of the brain. And it's because it helps us get control of our body. and start to be able to feel the body. So in trauma, even if we're in that fight flight and not necessarily in, of course, the freeze, but we're disassociated, we don't feel our body. And so martial arts really helps you start to feel your body. And then, you're going to practice katas and get where you have to learn to be very precise and get control of your body. And I didn't know I had trauma when I was doing martial arts. And I think that's one of the reasons I was so regulated. It's because it was a place that really helped me innately be able to regulate.
And in your educated opinion, how big of a factor does trauma play a role in mental health struggles? So it could be anxiety, depression, borderline personality disorder, bipolar, schizophrenia, OCD, the list goes on.
Yes, I love this question because I'm going to take Bessel van der Kolk's answer. The whole DSM could be labeled trauma. So I think now I do know we can have some imbalances and that medicine can help, and I'm not opposed to that. And I think when we do that, we also need to be doing the trauma work because I think all these things stem from a stuck nervous system. And if somebody tells me they have anxiety, 99% of the time, I can find through using somatic experiencing. It's not because I'm special. It's where that originated from and resolve that, and it starts to resolve the anxiety. So
you believe somatic sessions can help people who are struggling all over the board?
absolutely, yes. And I would say when I first did my therapy, I did talk therapy, and that was cathartic. I felt heard and seen, but didn't change any of my somatic issues. And then I did EMDR, and that helped some. But the first somatic session, I came back and told my EMDR therapist, and he was wonderful. And he was like, "You don't need this anymore. You need to do somatic experiencing." I was like, "Yes." And I do because it shows it's based on neuroscience, interpersonal neurobiology. And so every single session when I'm doing somatic therapy, I'm just walking through those 5 elements that Dan Siegel showed us is how trauma stores in the body. And most of the time we find resolution.
Sure. And what is PTSD and complex PTSD?
Yeah, so somebody asked me this question yesterday. So if we add the complex, so I say PTSD is, trauma, and not just, I know we associate that with veterans and things like that, but it is also over other events where we're having disturbing, where we think about it a lot. We have flashbacks. And, if we're looking at the criteria, I'm looking at PTSD where your nervous system got stuck. I'm always taking it back to polyvagal theory. Complex PTSD may not be it's not going to be a single event. It's going to be things that happened in our childhood and it's pervasive. And that's, maybe mom didn't hit me, but every time I came to her crying, I was told to be quiet or, it's pervasive events over our childhood, and a lot of that is going to stem from attachment, or our emotional needs weren't met, or we had one of these adverse experiences, which is a way we can measure that as well.
Okay. And people with PTSD, they also struggle with deep shame and guilt and connecting with others, that often pushing people away. What advice would you have for people that are struggling?
Yeah, that's a great question, and that's one of the things I love. I think is the core of what we do is we all want to connect, and we want to lower our PTSD symptoms so that we can feel safe and feel safe with others. Because when we're stuck in that fight, flight, or freeze, we see other people as a threat. And I don't think it's cognitively, the body sees them as a threat. And until we can get our nervous system So we want to get our nervous system regulated so others aren't a threat. And then that allows us to be able to connect. And one of our therapists wrote a curriculum on couples. And it's not just couples, though, it's relationship. And our bottom rung being trust, but trust in the sense of I feel safe with you emotionally and physically. And that's our goal, to be able to help people to be able to
That's healing.
connect. Yes. Yes.
That's a huge part
Yeah.
of healing, is feeling safety and being able to connect and feel safe.
Yes.
Okay.
Yeah.
And repressed anger, especially when we come from, at times, faith backgrounds or different spiritual backgrounds, we can be taught to push it down. And repressed anger can cause high blood pressure, symptoms of OCD,
Yeah.
anxiety, depression. What advice do you have for people that are struggling in this area?
Yeah. I love working with anger. Um, and one, anger. So we have you can see a chart back here. I can send it to you. I did a rendition of polyvagal theory, and right below freeze, when you come out, is anger. And so I'm like, when we're angry, like we're not in the dorsal, which is the hardest, that freeze, which is the hardest to come out of. And that repressed anger can just be when I'm specifically working with that, a thwarted fight response. And so, you mentioned faith. I think God gave us all the emotions, and emotions motivate us to do something. And I think, anger can motivate us, if our child's being hurt, to protect them. So I don't think it's a negative emotion. And then the way I work with it is we have to figure out why it's there, and the action that we want to put with it. So what is it motivating us to do? So if I'm angry, at the person who cut me off in traffic, I'll ask a client, like, what does that make you want to do? It makes me want to punch them. And so in somatic therapy, we will go, okay, so we're going to do that really slow. It's not that we're ever going to do that. We just want to let that response out. And so we'll be like, okay, show me that punch. And we're going to do it really slow. And then usually that will, if it's a specific event, move it through the body. If I was just working with somebody and they get angry, they want to know what to do, I have, I don't know where my little balls went. I have these balls we squeeze, and I will ask them just to put all their anger into that, and we're just going to squeeze, 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 and then rest.
Or you can use the same thing with a pillow, right?
Tell me about that.
Right. Oh, I don't have a pillow on me, but just bringing up the pillow and feeling into the anger, or squeezing your fists,
Yes.
stomping your feet, going against the wall and just putting pressure on the wall.
Yeah, we call that push-ins. Yes.
Yes, and feeling in and just allowing whatever comes up, whatever you want to say, whatever noise that comes out, and just allow it. Just allow the anger. And even again, sometimes it can be a little bit scary. I know in sessions, I'll feel anger come up and then it quickly goes away. And it comes up and quickly goes away. So just allow yourself to feel it even a little bit at a time. It's almost, again, turning on a tap, a little bit at a time. And then you can go back into a resource, but allow yourself to feel the anger, allow your body to respond how you want it to. And even if someone has had a sexual assault or has been attacked, I know, like I said, someone put their hands on my throat. I did do the response at that time. I did what I wanted to do. I fought back.
Yeah.
But sometimes we can go into a freeze because we don't feel like we can fight. We don't feel like we can flee. So our bodies just freeze. And sometimes that can cause us to feel guilt or shame.
Yes.
Because we didn't respond how we wish we had. But in a somatic session, we can finish that response. We can do exactly what we wanted to do when that person was attacking us, when that person was going after us. Or we can say to whoever has made us angry what we wanted to say.
Yeah, that was beautifully said. That's what I want to say. Yeah, because that's exactly what we do. And putting the judgment aside on it, just like you said, like no judgment. This is
No
just what
judgment.
our bodies.
Everything's welcome.
Yeah. And what I like to tell people, because I never want them to think that's what they should have done, is your brain just likes that. I call it the SWAT team. If they go in and they make a mistake, they come back out and they're like, what can we do different? And your brain just likes that. And so it's just giving you another option if you were in that situation. Not that you're going to be, but it just your brain likes to be able to work that out.
It's finishing the response because
Yeah.
that's part of trauma is when we were not able to complete the response and we just
Yeah.
froze, right? And
Yeah.
it's a letting us being able to finish the response. And like everybody may have wanted a different response, but this is allow yourself to respond how you personally would have wanted to, right?
Yes. Yes.
And I think that's why when that man put his hands in my throat and I was able to fight back and actually win, why I don't feel like I had a lot of trauma from that experience
Exactly.
because I was
Yes.
able to complete it. I didn't want anyone to touch my throat after that, but it could have been a lot more traumatic if, say, I had dissociated or I had frozen,
Exactly.
but I was able to respond and complete that response. But many, many people, unfortunately, are not able to. And in the somatic session, that's exactly what we're able to do.
Yes. Beautifully said.
Thank you. Um, okay. And why are some people more impacted by traumatic events than others?
Um, I think what you just said explains it beautifully is if we didn't get to complete that movement, if we went into freeze, or, and this is probably the one of the guts of it, is because of attachment. If it didn't have anybody to go to afterwards, if I didn't have, I had a trauma and I had to keep it silent, or um, yeah, just because I think one of the reasons, because you look back and you go, okay, like 1,000 years ago, we weren't doing somatic experiencing. So how are they getting through trauma? Well, I think it's because they told stories. They were there for each other. There was touch. There
There's
was,
community. We're not
yes,
isolated.
yes, yeah.
And
And so
I
I think
also believe, sorry, go ahead.
I was just say just a combination of the attachment community and then not getting to complete the
And
response.
I also believe that when we have deep developmental trauma, we're more likely if and as an adult, we're more likely to if say we go to war or have some type of traumatic event happen, we're more likely to develop PTSD than
Yes,
someone who had a very secure, nurturing home environment
yes.
because they had that support and they had that support growing up. And that's basically in their nervous system.
Absolutely. I've been surprised working with veterans. We're doing some pretty, we think we're going to do some pretty, graphic things. They've been to war, and it flows back to dad, or mom, or, and so I always like, I think I'm not sure who says it, but that attachment trumps trauma.
And so, if we have a loved one who has experienced trauma, the best thing we can do for them is give them love and support and just presence, just be there to hold space. Is that correct?
Yeah, absolutely. And I think being as regulated as we can and understanding that, um, you know, as the person understanding that just because I ask you to do something and you have a reaction that's not appropriate, that's from your PTSD, that's not about me. Yeah. And, I do recommend, like, not necessarily that we tiptoe around those things, that we continue to do those things and help this person get help. Because if we just change the environment, that's not helping them.
And somatic sessions can totally help us when we go in, and even our healing journey. It's like it helps us find our authentic self, our core. The more we do, it's amazing. And people watching today, some of them are never will never be able to go to counseling and receive a somatic session, what advice do you have for those people?
Yeah, that's a great question. Is being able to connect your experience. So you probably know, most people probably know cognitively, when my fault, or I didn't do this, but being able to connect the body with that, and we actually even can do that with an experience. And like, I know this in my brain, and where's that land in my body? And then what does it make me want to do? That incomplete response. And while I think it's important to have a witness, I realize, therapy's expensive. Not everybody's going to get to do this. But that's one of the ways we can help start to move it from the body. So instead of just getting rid of that feeling I have, is figuring out why it's there and what does it motivate me to do.
And sometimes our trauma was happened to us as a baby before our memory.
Right.
However, it's trapped still in our nervous system. And that's where some therapies will not be able to help us. But somatics is still, we're able to help with our nervous system and release all the emotions throughout our whole life that we were able to process. Is that correct?
That is correct. And that's what's so neat about it, because people be like, I don't have any memories from my childhood. I'm like, well, your body remembers. Yeah. So even as a baby, we have those, the body remembers. And one of the cool things we can do when we have that trauma as a baby and that baseline dysregulation is Dr. Bruce Perry's work shows us um, doing repeated rhythmic activity is one of the most important things we can do. And I think that's why, you and I ran or biked um, and it mimics. So it's a little different than actually going out and exercising. You do it at a slow pace. And he says 5 to 7 minutes is the lowest you can go. Like, that's the baseline, but that's not very long. And this mimics how it should have been. It doesn't matter if it was in utero. And so we're just keeping our heart rate, below 80. And you can get in a hammock, you can rock, you can walk, you can bike. And that helps us reset the nervous system to, from if we had these, well, from any time, but especially like as babies, and it just got set there when we were born.
Well, thank you so much for joining. It was an honor to have you. And thank you, everyone, for joining in.
Thank you so much for asking me. I really enjoyed connecting our stories. And
Yes, and I'm also a runner too, so our stories are adding up very much. Yes. I was, and my nervous system was so out of whack. Once I was running up a ski hill with a tire on my back repeatedly till my knees broke out and my ankles. So I'm really like listening. I'm like, yep, 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 yep. Makes sense to
yes.
me.
Yes. Well, thank you for what you're doing. I really love that you're putting this information out.
Yes. Well, thank you so much.